Okay, I'm going to be doing a focused assessment on a patient that has had an appendectomy. So first, I'm going to do my pre-procedural. So I'm going to check my patient's chart, gather all my supplies, wash my hands, introduce myself, explain the procedure, provide patient privacy, and then raise the bed. So, hi, my name's Brittany. I'll be your nurse today. Can you verify your name and date of birth? Perfect, thank you. So, I will be doing a focused assessment on you today. I will be checking out your incision site from your surgery and making sure everything's going okay with you. First, I want to do my pupils. So I will be, I'll have my pen light and I will be checking for Perla. So pupils are at a 4 and go down to a 2, 4 down to a 2. I could do cardinal gazes at this point to check for some cranial nerves. I'll look inside the mouth for the mucous membranes, have the patient stick out their tongue, and then I will be moving on to listening to the lungs. So just start over here. Like this, and then I can also be listening to the heart at this point, and checking for any arrhythmias or anything like that. I will be assessing the patient's surgical site, so I will be looking at the abdomen. I can auscultate, but since they had an abdomen surgery, I probably don't want to palpate. That could prevent or that could cause further harm. So I'm just going to look, listen at that area, and then making sure that I can hear some bowel sounds. I'm looking at the surgical site, making sure that there is no redness, warmth, or any, making sure that there's no redness, warmth, or drainage coming from the wound or the surgical site. I will, if they have like a catheter or something like that, I will also be checking that site as well, keeping patient privacy. So, like if I'm working on the abdomen, I will just look at the abdomen and cover the rest of the body. While I'm looking at the surgical site, I can also assess for skin triggers, so just pinching near the clavicle area, making sure that that's bouncing back. And then I can also do my respiratory assessment on the posterior side as well. And then for the arms, I'm going to check the IV site. I'm going to be checking for range of motion, so having the patient bend their arms, maybe raise them up. I will be assessing for the pulses, doing the brachial pulse, radial pulse, I can do apical. When I get down to the legs, I can do those pulses as well. I'm also checking for capillary refill, so making sure that the nail beds are pink in color after squeezing them. And then I will move on to, I will also check for edema in the arms and in the legs, looking at feeling for temperature and those sorts of things. Once I move down to the legs, I am going to be, again, looking for edema, checking temperature. I'm also assessing for any pressure source. So, like on the heels of the feet, that's a pretty common area. On like the tailbone area, sometimes you'll see some pressure source there. I will be checking the, sorry, that's very loud. I will be checking the popliteal pulse and gosh, I can't think of my train of thought. Anyway, then I will be finished. So once I complete all of those assessments with my patient, I will raise their bed back down, ask them if they need anything, give them their call light, I will clean my supplies, wash my hands, and document.